So the two things to remember when you're an MD PhD student are that you are living your 20s right now, or perhaps you're a little older, and this should be like the time of your life. So don't delay being happy or doing things that are important to you because you're in training. Over the last 8 years, like I'd never even run a 5K before med school, and I ran 2 marathons. I got married. I traveled like to 10 amazing places that I never thought I would have time to do. So don't put stuff off because you're an MD PhD, like do it now. And the second thing is that the only thing you can ever control is your attitude about something. And I think that there's a lot of things that in medicine and science that might seem like a little bit frustrating in the moment or seem kind of pointless if you have tunnel vision and you're just thinking about like your next deadline or what you have to do now. But if you stop and say, well, every single day I want to get the most I can get out of this experience and like learn when I can learn it or enjoy it and have a kind of a different frame of reference, then really every day can be delightful. There's even rotations that I will never be like an obstetric and gynecologist person. I didn't enjoy that rotation that much. But I remember mornings when I decided I'm going to have a good day and I'm going to learn as much as I can, that it was actually really fun. And I think that that just can be applied to every part of medicine. Like step 1 setting doesn't have to be miserable. It can be fun if you decide not to be miserable. So, and then my advice for prospective students was that it's okay if you're naive. It's really fun to do MD PhD training. Just know, as long as you're very curious, you want to understand how things work, and you're excited about the possibility of using science to improve health through discovery, I don't know, it's a really super fulfilling way to learn and to train, and I'm extremely glad that I did it. I've had a fantastic 8 years. I'm kind of sad to be finishing.
So for prospective MD PhDs, I would say it is a really long training path. And I didn't realize like what 8 years really means, and now it's taken like 10 because of the extra 2 for the startup. And you change so much over that time, especially because you're putting yourself into an environment where you're supposed to change over time. You're supposed to like aggregate all this medical knowledge and these experiences in the clinic and in the hospital and talking to patients and just understanding other people on a whole new level, physiologically, but also from an emotional perspective and what their values are and how you merge that with their care. And you layer on top of that then doing a PhD and changing yourself to be able to ask a rigorous scientific question and then pursue that. And it's usually a difficult thing, right? Because no one's ever done it before. That's the whole point, a new piece of knowledge. And you're going to have to like rigorously and just kind of doggedly pursue that until you get to an answer so that you could finish your PhD and then get thrown back in to a clinical environment. And so you just change a lot. And I think it's really hard to appreciate how much you change. Like when I came, I wanted to do surgery and I was going to do protein folding. And so now, it's going to be like internal medicine and this completely different biomedical informatics, startup-y thing, which I think makes more sense overall, but very different than what I thought I was going to do when I came here. And so as part of that, it's okay to reevaluate at each point and think about like, here's where I'm going. Is that where I want to go? Because there's no point in like working really hard to go a place where you don't want to go. And then in the case that you're sort of looking forward and you're like not happy, then it's totally okay to reevaluate. And I had some really great mentors that, when I was thinking about all these different things and talking to them, it sort of gave me permission, like, hey, it's okay if the first plan you picked is not the one that you're going to end up going with. You change as a person, the situations change, and you want to be aware of that, and you want to modify your path, your trajectory, so that you're going in a direction that you actually want to go. So I think those are like really useful lessons that it took me a while to kind of figure out, and that was nice. I was much happier, right, after I kind of like came to peace with like, okay, I had a plan, because I decided when I was like 12 years old, I'm gonna go do an MD PhD, which is insane, right? But it was like, oh, you know, I just found out you could do it, and it's like, that just sounded so cool. Like, I love medicine, the body's so interesting, the PhD sounds like a good mix, and like, I didn't really know like exactly what I wanted to do, but kind of just trotted down that path, and I was like, I'm gonna go do it. It's very maybe nerdy or embarrassing to mention, but my AIM screen name was Pedro. I did PhD MD because MD PhD was taken at the time. But that was actually my screen name like all those years ago. And so here we are, you know, and I kind of ran after it. And then to get into the middle of that training course and kind of be like, oh, maybe I'm not going to do the surgery thing and the protein foldy thing. And to adjust like that was hard. But it made more sense. I was happy with the project and sort of shifting direction. And it's okay. It's totally okay to change your plans. And I feel like a lot of us sort of decide we're going to go down a trajectory, and we're very good at like doggedly pursuing that path all the way through to the end. And on one side, that's really good. But you know, the other side, if there's other things that come up and you kind of change your views, then it's totally okay to adjust. And that's how, you know, that was part of the startup thing too, right? It kind of adjusted and then saw these opportunities and different things that we could do that I could only really do if I went off the path again and went and did a startup. And it sort of seemed like the easier way to try building cool things for doctors to use when they're seeing patients. So that seemed like the exciting thing to do. And so we changed our path and figured out how to go. And we've been really happy and excited about it.
I think one of the biggest things, and you wouldn't guess this by knowing me right now, but when I started in the MSTP, I had no volunteer experience, no extracurriculars as an undergrad. Like, I was just not involved. I played football and I went out with my friends. That was about it. And now I'm like at the back end, I'm doing this, I'm doing the newsletter, I'm like trying to get plugged into the program as much as possible. And so that's how the program has changed me. It's taken me from this person like very much involved and concerned about myself to like involved and concerned about the community as a whole. I'm not quite sure how that happened. I think it's part of the structure, you know, being put on SAC, being put into these various leadership roles, and then just putting yourself out there in the MSTP, sort of like catching you and encouraging you to like try these new things that you may never have done before. So I'm like really grateful for these opportunities. And then I'm happy to give back to the program. It's just been like a very nice synergy these past few years, especially this year as an M4. I feel like we've all gone on a whirlwind tour, giving back to the program. It's been kind of dope.
There were a lot of things we had to sort of balance. Like logistically, it's really difficult to figure out because the path, the entire MD PhD thing, right? It kind of like layers on top of another sort of very linear thing, right? You come in MD 1, 2, 3, 4. You know, maybe you take a year off for something else, but then you go into residency and then you go to fellowship, and like figuring out all the requirements and the things around that, because there were things about, you know, can we get our requirements still done? Will people even support us and like allow us to do this thing? Will they let us back in if we go off and do it? And then everything that we wanted to go try to do with the startup was very high risk and nebulous, right? Like, you know, it could have kind of failed after 6 months. We could have just run out of ideas. I don't know what to do, right? Could have just never been able to get any funding. Could have never had anyone that wanted to use anything. So it was a lot about sort of like this very nebulous, risky thing, and then this other very like routinized track, and somehow like figuring out how to combine those two things was really difficult. And the support that we had was super important for that. And then just, we really, really wanted to do it. Like I couldn't basically go in and do any clinic day or any day in the hospital without thinking basically every hour, like, oh, here's another thing. Like, it shouldn't be like this. Like, this is crazy, right? Even in a course I was just in, the internship preparation course, they're talking about orders and how you sort of have to rank and prioritize things. And I just like can't accept how much friction there is to like put in a simple order, right? Like it should be like a one-step thing, but you have to like jump through all these hoops, and there's an informatics challenge there, there's a user design challenge there, and all of these like things. Like I just can't like, I have a very difficult time accepting things as they are if I see that they're very bad or suboptimal or unpleasant, and I feel like there's a shot to fix it. And so like we were just kind of like driven to go like try to do something in this realm, and kind of just made the things work and had support in the process and ran off. I mean, that's what just happened, right? It's just like, we have to do this. I can't go to residency now. Ravi, are you in? He's like, yeah, let's do it. And we managed to kind of make everything work.
So I had a ton of fun in graduate school, which I think has to do with a lot of factors. But when I think back on my graduate school experience, what I think was most valuable that I want to encourage every MSTP student who's choosing their graduate lab or thinking about their thesis project to consider is in PhD land, you have one of the only opportunities that you'll have in your career to take a project from like very beginning to very end and have that not necessarily be a home run. And I think that that is an incredible learning experience where you can, because it's really different to start a project than to pick up a project that someone else is already working on and already has the first phenotypes, already has the first, has kind of gotten that first hypothesis tested and has something for you to start on, versus you starting a project and who knows, and your first like 10 experiments might be totally useless, or they might tell you that the project's not very interesting, or they might be fascinating and like drive the rest of your PhD. And likewise, it's also really different to take a project at the very end and think about like finding those last little mechanistic details that take something from a cool observation to like a rounded out story that you can publish. And that I think is a big difference between doing a PhD and doing like a year off for research, or even the difference between being a PhD and being a postdoc is that you can do that and it doesn't have to be awesome. Like if it's awesome, then fantastic. If you have an idea, you start a project and everything works beautifully and you get a great paper, then that's wonderful. But it's also fine if what you find is not that interesting or doesn't work out the way you expected it to, or you do it differently if you were to do it again. And that's like to me, that's the whole point of the PhD, is that you got to have that whole experience of beginning to end without cutting corners, and so that you know what to do next time. Does that make sense?
Yeah, absolutely.
And I think that sometimes when you're doing a PhD in a combined program, you might feel a little bit of pressure to, I actually didn't feel this, but I hear this when I talk to other people, pressure to be efficient, or to pick a smart project where you're going to be able to publish well and finish your PhD in a timely fashion. And I think that those aren't bad things, but I strongly encourage any starting MSTP student to start a project and see it from beginning to end. Even if they want to do something, like if you're doing more translational work, you might not be able to start something that's like a clinical trial and see it all the way to the end. But maybe a smaller project where you really initiate and go through the whole steps, I think that's the learning experience that's unique in your graduate school career that will inform all of your research in the future, because you went through that whole journey with a scientific question.
Yeah, so a reflection on MD PhD time for me. I mean, it's been a really great program. I keep telling people, because it comes up, oh, you're in biomedical informatics, or you came here to Vanderbilt, and like, how'd that go? And I basically always tell them that I'm really fortunate, because I came here based on half gut decision of like, I just really liked my incoming class, and I liked the vibe for Vanderbilt as a whole. And then I had this inkling that there were more people that I would like to work with here. So if I was going to play the numbers, that I would have the most opportunities to like have a really great experience if I just came here and I liked the vibe. And that's how I made the decision. And it ended up being far better for me even as I changed over the years, than I ever anticipated. So, you know, the biomedical informatics department just gets better and better, and it has more and more awesome resources, which is really exciting. Nashville's ended up being a really big startup place, which also didn't even know I was going to go and want to do a startup later on. But here we are, where sort of Nashville and I kind of both went into startups together. And Nashville obviously has a long history of sort of healthcare tech and some startups. But I feel like it's growing a lot, as Nashville is overall. And then even Nashville has just gotten better over the years. So I feel like it was a really good decision, and I didn't quite realize how good a decision it was going to be. But I'm fortunate for that. I also really appreciate the leadership, like the med school and the MSTP leadership. So awesomely supportive. Obviously my path is a little bit more unique, but it's something that I really want to do, and Ravi really wanted to do, and they supported us through that, and they helped us kind of figure out, like, how do we fit this in and how do we go try it. And we were always kind of nervous that maybe they're going to think we're too crazy or we're too distracted, but we were just really dedicated to the project because we thought it could make a really big impact clinically, and it used the skills that we had kind of built up over the years, and we wanted to take a shot at it. And it's been a challenging road, a very exciting road, a really great learning experience, but I don't know how we would have started down that path without that nice, friendly, supportive environment that we had. So that all just worked out super well, and I really appreciate that.